So you're planning to retire before age 65. That's the dream, right? But there is a huge financial trap that can cost you tens of thousands of dollars every single year. It's kind of like this hidden cliff that so many people just fall right off of without even seeing it coming. But what if I told you there's a way to navigate around it and save yourself an absolute fortune in the process? Okay, let's dive into this.
Here's the central puzzle. Just imagine two couples, both getting ready for early retirement. They pick the exact same health insurance plan, same network, same doctors, everything's identical. And yet, one couple gets a bill for about $5,000 a year, while the other is looking at a staggering $28,000. How is that even possible? What could justify a $23,000 price difference for the exact same thing? Well, the answer has nothing to do with your health or even how much money you have in the bank. It all comes down to one specific number.
And this is the part that is just wild. Look at how sharp the edge of this cliff is. If your income is $84,000, your annual premium is pretty manageable. But if you earn just $600 more, $600, your income hits $84,600 and bam, your premium skyrockets by $23,000. It is not a gradual slope, it's a sheer drop. There's no partial credit, no warning shot. You're either under the line and you get help, or you're over the line and you're paying full price.
All right, so let's get into the nitty-gritty of this thing. This isn't just some weird loophole. It's actually baked into the structure of the system. Let's really explore what this cliff is, and more importantly, why it's about to become a much, much bigger deal for anybody hoping to retire early.
See, for the last few years, we've had these enhanced subsidies that offered some flexibility. If your income went a little bit over the line, your premium would go up, sure, but it would go up gradually. It was a slope, not a cliff. Well, that flexibility is set to expire. In 2026, the old system comes roaring back, and with it, a hard income cutoff. If you cross that line by even $1, you lose every single penny of your subsidy. This completely changes the game.
So to stay on the right side of that cliff, you have to understand the one number that this entire system is built on. And it's not your net worth, it's not even what you spend every year. It's a little acronym called your MAGI.
MAGI. That stands for Modified Adjusted Gross Income, and it's the only thing that matters here. You know, the healthcare system doesn't look at the millions you might have saved up. It's not designed to measure your wealth, it's designed to measure your income for that specific year. It doesn't care if you're traveling the world or helping your grandkids. It only looks at this one, very specific income calculation to decide if you get thousands of dollars in help or nothing. So understanding how this number is put together, that's everything.
So what actually goes into this all-important MAGI number? Well, a lot of the usual suspects are here. Any money you pull from your traditional IRAs and 401ks, for sure. Capital gains from selling investments, any dividends or interest you earn, pension payments, that all counts. But here's the big one. This is the trap that trips up even the most savvy investors. Tax-free municipal bond interest. You heard that right. While you might not pay federal income tax on it, the government absolutely counts it when it's calculating your MAGI for these subsidies. It's like this hidden income that can shove you right over the cliff when you're not looking.
Okay, so theory is one thing, but let's make this really concrete by looking at the actual story of a couple named Tom and Susan. Their situation perfectly illustrates how this problem plays out in the real world, and, more importantly, how it can be solved. So, meet Tom and Susan. They're 60 and 58 years old. And look, they have done an incredible job saving for retirement. They've got $3.4 million socked away, spread across different types of accounts. They have more than enough money. They've played by all the rules, and they should be popping the champagne, right? But there was this one giant obstacle standing in their way.
And this quote from Susan, it just really hits you. She was a teacher for more than 2 decades, and she was so ready to be done. But when she ran the numbers herself, she saw this $28,000 annual premium just waiting for her. The thought of shelling out over $200,000 on healthcare alone before they even got to Medicare, it just felt impossible. She was genuinely convinced her dream of an early retirement was over, all because of this one terrifying number.
So what was the issue? I mean, it wasn't their savings, it wasn't their spending plan. The problem was hiding in plain sight. Their taxable brokerage account was just automatically throwing off over $30,000 a year in dividends and interest. Think of it like trying to stick to a diet, but you wake up every morning and someone has already put 1,000 calories on your plate before you've even had a bite at breakfast. This automatic income was counting against their MAGI whether they spent a dime of it or not, and it was pushing them dangerously close to that cliff before they even pulled out their first dollar for retirement living.
The good news is, a problem you can define is a problem you can solve. And for Tom and Susan, the answer wasn't to earn less or to spend less. No way. The solution was to get really smart about where their income was coming from. They used a technique we're going to call the blended withdrawal strategy.
Probably the best way to think about this whole approach is to compare it to a kitchen renovation. You know what I'm talking about, right? For a few months, your house is a total disaster. There's dust everywhere, you're eating takeout on the floor, washing dishes in the bathtub. It's a mess. But you put up with all that short-term pain because you know that for the next 20 years, you're going to have this beautiful, functional kitchen that you love. That is exactly what they did with their portfolio, a short-term strategic mess to set themselves up for massive long-term savings. Okay, this slide right here, this is the whole magic trick. So they need $140,000 a year to live on. Now, if they just pulled all of that from their traditional IRA, their MAGI would be $140,000 and boom, they're way over the cliff. But instead, look at what they do. It's a blend. They pull $40,000 from the IRA, that counts towards MAGI. They sell some stock and take $20,000 in capital gains, that counts too. But then they take $30,000 from their Roth IRA, which doesn't count because they already paid taxes on that money, and they take another $50,000 from the principal in their taxable account, which is just getting their own original investment back, so that also doesn't count as income. And look at the result. They get the exact same $140,000 lifestyle, but their official MAGI is only $60,000. It's brilliant.
And when you look at it visually like this, the difference is just night and day. On the left, you've got the simple, default strategy that most people would just naturally follow. It leads to a MAGI of $140,000 and a giant healthcare bill. And on the right, with this strategic blended approach, their MAGI plummets down to $60,000, keeping them safely under that cliff. It's the same life, but a completely different and way better financial outcome.
So what does that difference actually mean in real money? Well, over the 8 years until they both get on Medicare, this one strategy is projected to save them about $180,000. Just stop and think about what that kind of money represents. That's a decade of incredible travel. That's the Airstream trailer they were dreaming about buying. Or, maybe it's just the deep, profound peace of mind that comes from knowing you didn't leave a life-changing amount of money on the table just because you didn't know the rules.
Now, we've got to be really clear here. This isn't a free lunch. Like any sophisticated financial strategy, it comes with trade-offs. You're solving one very big problem today, but you have to be aware of the potential consequences that could pop up down the road.
So here's the core trade-off. By grabbing those subsidies, you are saving a huge pile of money right now. The flip side? Well, by using money from your Roth and taxable accounts so early on, you're giving up some years of that beautiful tax-free or tax-advantaged growth. Plus, by not drawing down your traditional IRAs quickly, you could end up facing larger required minimum distributions, or RMDs, later on. And those are the withdrawals the government forces you to start taking in your 70s, which can create their own tax problems.
But a really good plan doesn't just solve today's problem, it looks ahead to tomorrow's. So this strategy doesn't just stop when they turn 65. The second part of the plan is to use those low-income years between 65 and 75 after they're on Medicare but before those RMDs kick in to strategically convert money from their traditional IRA over to a Roth. This means they'll move the money and pay taxes on it while they're in a lower tax bracket, and then that money can grow tax-free forever. They're not ignoring that future tax bomb, they're carefully diffusing it in stages, all while capturing massive healthcare savings today.
I think Tom's reflection really says it all. The real burden they were carrying wasn't just about the money. It was that awful feeling of being trapped. It was about the years of their life, their actual life capital, that they almost sacrificed because they were staring at a problem that just felt completely unsolvable. Finding this path forward, it changed everything for them. Susan went from saying, maybe I have to work until 65, to putting in her retirement notice.
So the crucial takeaway here is this. Sometimes, the biggest obstacles in our financial lives, the ones that feel like giant mountains, are really just walls we can find the way around. They just require looking at the rules a little differently. This MAGI cliff is just one example. And it leaves me wondering, and it's really a question for all of us, what financial cliffs, what hidden taxes or penalties or lost benefits might be waiting for you in your own retirement plan?